you ever had a sprain or a really stiff neck? It's not just one thing. It's the pain, the swelling, and the muscle spasms all at once. It's a real triple threat. Well, today, we're going to break down D-Fresh MR, a prescription tablet that's built to fight all three of those problems at the same time.
Right? Just imagine that for a second. That sharp pain in your back after moving furniture, or maybe a sprain from your weekend game. It's never simple. You've got that throbbing pain, the area starts to puff up, and your muscles get all tight and knotted. So this question is really the core idea behind D-Fresh MR, tackling that whole mess with a single pill.
So here's our game plan. First, we'll cover what this stuff actually is. Then, we'll dive into how its specialist team of ingredients gets the job done. We'll follow its journey through your body, talk about the right way to use it, and then cover the really important warnings. And finally, we'll wrap it all up with the key things you need to remember.
All right, let's jump right in. What exactly is in this pill, and what does it mean for it to be a combination medication?
Think of D-Fresh MR as a Swiss Army knife for a certain kind of pain. It's not your everyday painkiller. It's specifically designed for things like sprains, strains, low back pain. Those musculoskeletal issues where you're dealing with that nasty trio of pain, inflammation, and tight muscles all at once.
And here's the team that makes it all happen. You've got diclofenac, which is a potent anti-inflammatory. Then there's paracetamol, a very common and trusted pain reliever. And finally, chlorzoxazone, which is there specifically to relax those muscles. Each one has a very distinct role to play.
So how does this trio actually work together? Because this isn't just about throwing 3 drugs in a pill and hoping for the best. Their actions are what we call synergistic. That's just a fancy way of saying they actually help each other work better, giving you more effective relief than if you took them all separately. I love this analogy, thinking of them as a specialist team. First up, you've got diclofenac, who we'll call the inflammation firefighter. It goes right to the source of the injury and puts out the fire of swelling. Then you have paracetamol, the pain signal blocker. It works up in your brain to just turn the volume down on the pain signals. And finally, there's chlorzoxazone, our muscle tension negotiator, telling those cramped, spazzing muscles that it's time to chill out.
Let's get a closer look at our firefighter diclofenac. It's what's known as an NSAID, a nonsteroidal anti-inflammatory drug. Its whole job is to block these little things called prostaglandins. You can think of prostaglandins as the chemicals that sound the alarm for both pain and swelling when you get hurt. So, diclofenac basically snips the wires on that alarm system.
Next up, paracetamol, our signal blocker. Now here's the really important difference. While diclofenac is working on-site, right at the injury, paracetamol works centrally, up in your brain. It doesn't actually stop what's causing the pain, but it changes how your brain experiences that pain. It raises your pain threshold, which is why I can give you that feeling of fast relief.
And our final team member is chlorzoxazone, the negotiator. This one also works centrally, but its main target is the spinal cord. It gets in there and interrupts the frantic nerve signals that are screaming at your muscles to stay tight and spasm. By calming those reflexes down, it lets the muscle finally relax and eases all that painful stiffness.
Okay, so we know how it works, but what actually happens after you swallow the pill? Let's follow this medication on its journey through the body. It helps you understand how quickly you'll feel better and how your body eventually clears it out.
So after you take the tablet, you can usually expect to start feeling some relief in about 30 to 60 minutes. It'll be working at its absolute best, what we call its peak effect, somewhere around the 1 to 2 hour mark. And it's not a long-lasting drug. Its half-life, which is the time it takes for half of it to leave your system, is also right around 2 hours.
The reason it gets to work so fast is that it's absorbed really quickly from your stomach and intestines. From there, it makes a stop at the liver, which does most of the work breaking it down. Then the leftovers are filtered out by your kidneys and leave your body. This quick trip really underlines why having a healthy liver and kidneys is so important when you're taking a medication like this.
Okay, knowing the science is great, but knowing how to use it safely is even more important. So let's get into the practical side of things, the best practices for taking D-Fresh MR.
For most adults, the standard dose is 1 tablet taken 2 or 3 times a day. You gotta swallow it whole with some water, no crushing or chewing it. And this last one is probably the most important rule of all. Always take it after you've eaten, a meal or at least a snack. That simple step creates a buffer that helps protect your stomach from irritation.
This right here, this is the golden rule for any medication that contains an NSAID, like diclofenac.
The whole point is to get relief with the smallest amount of medicine you need for the shortest amount of time you need it. This is a fix for a short-term problem, not something for managing pain day in and day out. Sticking to this idea is the absolute best way to lower your risk of side effects.
All right, let's move on to what is arguably the most crucial section for your safety. Look, every effective medicine comes with potential risks, so we have to talk about the key warnings and possible side effects for D-Fresh MR.
This lays it all out pretty clearly. On the do list, we already said it, but take it with food. Tell your doctor about any weird side effects and make sure they know about every other medicine you're taking. Now, the don't list, do not drink alcohol. It seriously increases the risk of stomach bleeding and liver problems. And since this can make you drowsy, be really careful about driving until you know how it affects you.
And these are the hard stops, the non-negotiables. Doctors call them contraindications. These are situations where you just shouldn't use this medication at all because the risk is way too high. That includes anyone with an active stomach ulcer, someone with severe liver or kidney problems, a known allergy to other NSAIDs like aspirin, or if you're in the later stages of pregnancy.
Phew, okay. We have covered a ton of information. So let's bring it all home and lock in the most important things to remember from all this.
So here's the bottom line. D-Fresh MR is a really effective tool. That triple action formula is great for short-term relief from those complex musculoskeletal injuries, but with that kind of power comes responsibility. It's meant for acute situations, not for managing chronic pain, and you've got to use it exactly as your doctor says to keep the risks as low as possible.
And that really leaves us with one final question to think about. Whether we're talking about D-Fresh MR or any other prescription, it's a good thing to ask yourself, am I using this as wisely as I can? Understanding what a medicine does and how to use it safely is absolutely key. And if you're ever not sure, just ask your doctor or pharmacist. Thanks so much for tuning in.